Hey guys, Dr. Tyler Hamel, Kingwood, chiropractor and nutritionist today, talking about aches and pains and stiffness. And everybody always thinks, and they say, Doc Hamel, man, I'm just so stiff in the morning. Hard to exercise. I roll out of bed and I'm just so stiff. I can't move my neck or my low back. Everything's painful and stiff. So there's a couple things to take into consideration when we look at the spine, and this is really important, which many people they don't think about it. They've really just never learned it before. So we have, say, areas of the spine and joints that are surrounding the spine that are either mobile or they're stable. So mobile meaning that they have quite a bit of range of motion. Stable meaning they're more there to stabilize things, to kind of hold things in place in a way. You can think of it that way. So when we look at the spine especially, it's always a rotating thing where you go from mobile to stable to mobile to stable and go down the line that way. So let's look at a few of these things. And as you can see on this diagram here, mobile in red, stable in blue. So when we look up at the neck, the very, very top of the neck, the first two vertebrae, those are supposed to be mobile, right? C1 and C2. But you look at the rest of the neck, up here in blue, it's supposed to be stable. So the whole neck is not supposed to be super mobile. So sometimes you see people and they're adjusting their neck and trying to get super flexible in their neck in general, whereas the top two vertebrae are supposed to have a lot of movement, but the other five are not supposed to have as much movement. They're supposed to be stable. And I always tell patients that if you're self-adjusting yourself, over and over and over all the time, year after year, it can become unstable. So unstable is a bad thing. Inflexible is a bad thing, but unstable is really a bad thing as well. So be careful about that. So that's the first two. Then we go to the thoracic spine, and you can see it's mobile, right? Thoracic spine, when we turn from side to side, we should have lots of mobility in our thoracic spine, but most of us don't because we're working on a computer like this all day. So that significantly decreases the mobility in the mid-back, and that's why we oftentimes we see patients come in and we have to adjust or release pressure in the mid-back and to try to get it more mobile, right? If it's not moving or inflexible, it's going to give you aches and pains, back pain, even neck pain and headaches. So that's the thoracic spine. Then we go down to the lumbar spine, right? The low back, and it's supposed to be stable. So when we look at this, and lots of times patients come in with low back pain and they're like, oh, I lifted something wrong, or Doc, I don't even know what happened. I woke up and it was like this. I always tell them that we want to look at the area above and below the back, because if those areas aren't moving, like the hips or the mid-back, that's going to put significant stress on the low back, which is a stable area. And putting too much stress on the stable area like that, it can't handle it, and then that might give back pain, disc issues, nerve pinching, and things like that. So then let's go down to the hip here, the next one on the right, the hip. So that's supposed to be mobile as well, right? We talk about in golfers all the time. Hip movement, clearing the hips, being able to move the hips. Even people who are working out at the gym doing deadlifts and squats, if those hips are not mobile enough, it's going to have to put extra stress on the low back. So mobility decrease in the hip and in the thoracic spine puts extra stress on the low back. The low back's supposed to be stable, and it can only be so stable when the joints above and below are not working like they should. And then we go down to the knee, and we see the knee is supposed to be a stable joint. We go down to the ankle, it's supposed to be a mobile joint. We go down to the foot, it's supposed to be stable. So you can kind of see the alternating, the stable or the mobile stable as we go down. When we look at a couple areas, other areas like, say, the shoulder blade or the scapula here in blue, we can see that's a stable joint. When we look at the shoulder itself, that's supposed to be mobile, right? So oftentimes with that, we see issues in stability of the shoulder blade because we do a lot of work on computers, and come this way, our shoulder blade kind of rolls in and rolls forward, making it unstable. So does this kind of posture and an unstable shoulder blade cause more shoulder issues? Absolutely it does. So we look at rotator cuff injuries or bursitis or tendonitis, impingement syndrome, things like that in the shoulder. So that makes sense. So, Dr. Tyler Hamel, just today explaining the difference between mobility and stability and how it goes or how it alternates as you go down the spine. So if these areas are off in a way, right, and when there's not enough mobility or not enough stability, that eventually is going to cause aches and pains. So as chiropractic treatment works, when we look at the spine and look at those areas, so stability areas, like how do we work on those areas to make them more stable, right? Corrective exercises every time. You've heard me talk about that a million times. Corrective exercises for mid-back shoulder blades, right? We have to improve the stability of the shoulder blade, improve the mobility of the thoracic spine or the mid-back. Otherwise, it's really tough to get better because we sit like this all day. So if you don't do something to counteract that, it's really tough to get better. Dr. Tyler Hamel, if you learn something about stability, mobility, hopefully learn something about don't be self-adjusting your neck or your low back, because some areas of the neck and the low back, they're supposed to be very stable. And when we're just making them more and more and more mobile by self-adjusting ourselves, then it's not going to end up very good. So if you learn something, like this video, thumbs up, share it, tag somebody in there. You probably know somebody who is maybe dealing with some pain, aches and pains, chronic pain, headaches, neck pain, back pain, sciatica, and it just isn't going away. And this can have a lot to do with it. Mobility, stability, right? Now you guys know. Hopefully you can apply it. If you're having trouble with anything, just leave a message in the chat box below. You can always call our office, go into the website. There's plenty of free information there that you guys can learn about. Again, Dr. Tyler Hamel, your Kingwood chiropractor, and